Welcome to the Ask Dr. Collins show. I'm Dr. Collins and this is Joe Marso, and we're going to be talking muscle activation techniques.
I met Greg Roscoff at Rancho La Puerta in Tecate, Mexico.
Yep.
And he wasn't teaching M.A.T at the time. He was experimenting with it, still developing it, getting the bugs out of it. But one of the things I was so impressed with, was that he knew every muscle in the body. And that's one of the things he said as a trainer. If you want to be a good trainer, learn where the muscles attach and what direction the fibers are going, then you can figure out which muscles are involved in any movement that you do. So if somebody cannot lift their arm up, what you'd have to know is, well, where's your axis? And then any muscle on this side of the axis can lift your arm up. And if your axis is this direction, anybody on this side of the axis is going to take your arm this way, everybody on this side is going to take this way. So if you know where all these muscles attach and what direction the fibers are going, you can figure out which muscles are involved in any motion. And then there's a hierarchy. So I have the most leverage when I'm pushing from here. So the muscle closer in doesn't have as much of a moment arm or a lever as the longer muscle. So a muscle that's attached up here and pulling this direction is going to have be able to generate a lot more force than a muscle in close. So when we're going through and somebody can't lift their arm up, what we want to look at first is who's farthest from the axis. Who's got the best moment arm in order to do that job, and that's where this hierarchy comes from. So that's where M.A.T is like the opposite of everything else, in that we're not blaming the tight muscles. We're saying that tightness is secondary to weakness. You have the tightness because you have a weakness in the area. So I had a nagging right hamstring since high school or college. I don't remember how long. But if I stretched that hamstring, the next day the pain, or right then the tightness was gone. And the next morning it was tight again. So stretched, ran my sprints or whatever, and then again that tightness would always go away after stretching it, but it always came back the next day until I had my first M.A.T session and they addressed the weaknesses in my hip. And once they addressed the weakness in the hip, the tightness went away. So another example, let's say, is like walking on ice. If you've walked on an icy, slippery surface, your body will naturally tighten up, thinking, I'm going to slip or I'm going to fall. But when you're on carpet, the body's like, well, I'm not afraid of falling. Mm-hmm. I've got stability.
That example that you gave with the ice was huge for me.
Yeah. Because
often people get in that mode of thinking that they have a disease or like a condition, that they have a rotator cuff problem. But that example of getting on the ice in your body intelligently, tightening up to guard a weakness, and then as soon as you get off of the ice, your body's fine, was a huge light bulb for me, because that's congruent with how I approach with chiropractic.
Yes.
So that whole mindset of, oh, it's tight, let's stretch it. Oh, it's tight, let's stretch it, that spans across PT, massage, even within chiropractic to a large extent. That idea that we need to go after what's tight and what's in pain, and that's your problem. I love that M.A.T was so diametrically opposed to that and so different. That instead of looking at the body as something being wrong with it and having to go after that in a hyper-focused way with what hurts, seeing what the body is doing as an intelligent adaptation. That was huge, that the body is intelligently doing something to prevent injury.
Yes.
And that instead of just trying to stretch out what the body's intelligently guarding, and then having somebody walk out of your office and say, yeah, it's loose, and I can meet my my requirements for Blue Cross, that I got increased range of motion today, and then I have to see you 3 times a week to maintain that range of motion. Instead of going in that route and then you leaving my office and coming back even tighter,
yes,
because the body had to go into overtime to lock that down again because it's still not stable.
No.
Right? Instead of having that mindset, looking at the body intelligently and with a different level of respect and saying, this machine is doing something on purpose, why?
Yes.
And then from there, digging in and saying, well, of course, at that hip, I have this muscle not firing properly, or it's on a delay. This muscle's not doing it either. That muscle's shut down. And so the hip is intelligently guarding to prevent me from tearing some part of that hip or muscle or something. And then going in there and systematically waking up and getting those muscles to fire again. And then the body naturally just opening up and giving you motion. Seeing, it's borderline miraculous, especially coming from the modern paradigm. It seems impossible. But when you look at it from the philosophy of the body is doing this intelligently, it's obvious. So that was huge for me when that ice example.
Yes.
So.
Yeah, and other thing I have to point out is I stretched. I don't blame anybody for stretching. I think the body is flexible and is designed to stretch. But just realize when you stretch or you increase your motion, you don't increase your strength in that motion.
I think of ballerinas.
Yes.
Right? This is an example that can bounce up against M.A.T. because you have a whole profession of people who are systematically stretching.
Yeah.
To lengthen the way that their body looks, to lengthen the muscles, to be able to achieve those ranges of motion, yet have a really high injury rate, right?
Yes.
I don't know the exact percentages, but I feel like ballerinas go down. They drop like flies.
Unfortunately, it is a pretty or aesthetic thing, but it's not biomechanically sound. There's a lot of good.
Why would that be a problem? Why would consistently trying to stretch to get that increased range of motion cause you problems long term?
Yeah, the stretching and without enough strengthening, and secondly, I think a lot of it has to do with everything being turned out.
Okay.
Yeah, the excessive turnout, and then standing on the tips of your toes like this. So,
right.
But so I think people that do point are in a lot more trouble than people that if you're just doing regular dance. But yeah,
you have to be careful not to piss off Maria, right?
That's
his wife. Did she do ballet?
Classical ballet.
Yep.
And fortunately, she was not forced into positions.
Okay.
Where she had several good teachers that you just turn out however much you can. But yeah, once you start forcing something, or you need the problem is they want a certain look in ballet. They want hyperextended knees. They want extended thoracic. You're taking you out of your normal range, really. I personally I'm not lifting a weight that I can't lift through a full range of motion. And like you said, there's one big guy. The guys tend to be the worst at the gym, and he's got 1 or 2 45 plates strapped to his waist, and he's doing dips about this much range. And I've seen another guy doing pull-ups, and he's doing pull-ups from here to here. Well, yes, you're going to be really strong from here to here then. So I would rather use the assisted pull-up machine or whatever, or do as many as I can on my own body weight, not that many. And then I want to go, if I go all the way down and all the way up, or pulling myself up, I'm working through a full range of motion.
But it requires an internal awareness of that muscle at its length, and then as it contracts fully, right?
Yes.
You have to be somewhat aware of what that feels like.
Yes, and I think any exercise you do with full range, again, overhead press, just the opposite. Once I get to the point where I can't straighten my arms, see, I can do that easily with no weight or with 10 pounds, but once I put the 50-pounders in there, I can do a few. But then it gets to a point I can't straighten my arms anymore. I got to go lighter, because I'm not going to keep working in a range where because I'm going to lose that flexibility. Mm-hmm. So if you are exercising in a full range of motion, proper strengthening will make you more flexible.
Exactly.
And improper, and again, will tend to tighten you up.
Yep.
And but the thing is, it's the ego. You're not going to impress anybody lifting light weights in full range of motion.
Well, you want to hit your PR. Again, it's just like the example of ballet. You're trying to conform your body to a number. Like, I have to hit 100 pounds today. That's what I'm going for, versus working with your body and maximizing its capability. You're trying to go the other way.
Yes. Yep. And walking lunges, or just anything that you're doing a long range of motion. I don't know if it's off subject or not, but hamstrings, like runners' hamstrings get tight, and the body's not trying to play a trick on you. The body's trying to make you a better runner. Because if you're a jogger, especially jogging, you're not taking a really long stride. And if you have a 100-pound body, think how stiff of a rubber band you would need to propel 100 pounds. And so you want to run, so the body's going to say, you know what, you want to run better, I'm going to make your hamstrings thicker and not as flexible.
So for that athlete, would you recommend that they are, when they're not running, that they are trying to do full range of motion exercises to prepare for that? Or is that sort of like counterproductive if the body's trying to get that muscle shorter? If it's trying to adapt it to that?
I don't know enough about training. That's a good question. Because
is it better to just run and get really good at running, or is it better to always try to get the muscle to be in a full range of motion with strength? You know,
I don't really know, not training runners, but my
for injury prevention, my thought would be is if you're always trying to have the body be capable and balanced.
Yes,
you're less likely for injury versus, if you're running, your body gets really good and adapts to running,
but it can't do anything else.
But you're also potentially going to injure the body long term. You should try to have a strong, integrated, balanced, symmetrical range of motion body to do the thing, even if it slightly challenges performance in the short term.
Yes.
Right? Depending on your goals, if you're more of a long term, you want to be able to do this for a while versus you're just going to the Olympics next month.
Right.
Right?
Yeah, because we want to be balanced, but I would still do some type of range of motion strengthening exercises.
Yep.
And it's just a stretching really. I'm sure you all done it. It's just,
so let's go there. Let's talk stretching, because I feel like this is one of the most controversial things around M.A.T. Right? I think of when I was in high school, the first thing you do when you get to class is you start stretching. Right? Everybody gets their gym clothes on, and then there's rows of 10 rows of kids that are doing this series of passive stretches. Why would starting off passively stretching before you go into, running or playing kickball or whatever your sport is, baseball, football, why is that not necessarily the best idea for people to start off just cold, passively stretching before they go do sport?
I think in the 90s they stopped doing the passive stretching and they found that...
Not in high school anyway. I don't know about college.
I can't remember.
A lot of people passively stretch. I mean, you see people that are doing the quad stretch before they go run.
Yeah.
Passive stretching is still a very common before people go play or train. I mean, there's still a lot of passive stretching. Why is that bad?
That seems
like a toy that I should play with.
That can be. This was supposed to be like a foot and a knee bent like this, but it can be anything you want. This is, of course, a very simplified model of.
Joe is a genius of models in spare time.
That's awesome. Of the body. Now, think, of course, these are 2 strings, and imagine how many strings of muscles you got. All these multiple directions going on in the body. So there's 2 ways. If I want to lengthen this muscle. There are 2 ways for me to lengthen that muscle. I can take my hand here and pull it this way, but I don't know if you can see what's happening to this side. This thread is now going under slack. That's a passive stretch. We're using an external force to lengthen this muscle, whether it's gravity or a strap or your hand to stretch something else.
So just by way of example, if I was trying to lengthen my tricep, that would be like coming over the top of that external force and stretching to get a deeper stretch.
Absolutely.
So now I'm doing that, which creates slack on my bicep, which should be the one that's...
And the same thing with the taking the arm across here. So I can take the arm across here. I'm stretching the posterior part of the shoulder, and the front is, you can see the shirt's wrinkling. Okay? So that's a passive stretch. So the active stretch is, if I want to lengthen this string, I can turn this knob, and now what I have tension on both sides. The body likes that. The body likes having this
neurologically.
And otherwise, you see with this too. As I bend this way, you can see some of these rubber bands going under slack. That's unstable, or unstable, something like that. Creating instability. Okay, so when everyone else is doing this stretching class, I got my hand on this side, and I'm actually contracting the.
You're using your back to pull that and open that shoulder up.
Yeah, so I'm contracting one side of the body to stretch the opposite side. And now you're creating strength in the body and not this slack. And I was going to say something else about that too.
But someone might complain and say, I need to get more range of motion. I don't feel like my stretch is deep enough, so that's why I'm going to go for that. You would say deal with it.
Well, you'll never be able to go as far actively as you can passively.
And the body is doing. This is where you have to respect the body. The body is intelligently limiting motion to keep you from injuring the joint.
Yes.
So if it's telling you got 30 degrees, you just take that 30 degrees. Now, as like a hack to this, right? I have not talked to you about this. This is me just assuming. If you were to passively stretch, right? Let's just say therapeutically, you want a deeper stretch, you need a deeper stretch in that joint.
Yes.
Is that okay if after that I come back over the top and actively contract, maybe even in both directions to stabilize that area and get muscle function back on? Is that okay?
Yeah, and that's what I was kind of saying earlier about abducting the leg 30 degrees, and now you stretch it, and now you can move at 45. You're not necessarily strong in that range. So once you open up a range, once you increase your range of motion, so in that case then, is once I passively stretch, now I'm going to go through a follow-up and tighten that string, and now I've got my balance back again.
Because clinically, what you'll see with people is, and I've seen you do this parlor trick on people, after you've activated all of the muscles and they feel everything firing good, you will passively stretch them to drive this point home on a muscle, and you will see, if you had to gauge it, what percentage decrease in either what delay will you see in a muscle firing, or overall kind of weakness percentage wise? Like, what do you see that will happen when somebody does passively stretch?
Well, that's why it causes an inhibition. And it's really, and often it's a global inhibition in the body.
So me just passively stretching my tricep is going to potentially now shut down activity around stabilization.
It'll dim the muscular system. And then the thing is
what percentage? 5%, 10%, 50%? What would you guesstimate roughly in what you will feel with people?
Immediately, it'll be I want to say 100, but that's too high. Yeah,
okay.
I mean, if we did a passive stretch, I could test any muscle in your body and it'd be off.
And then over the next few minutes, you'll see some kind of flip back on as they start moving around, but you'll see kind of a systemic decrease in activity, right? Why neurologically? Is the body perceiving this as an injury? What is that passive stretch to your body? Why does that happen?
Yeah. So it's one way of describing it is to say, imagine I had a cushion right here and I stuck my fingers in the cushion and I took my fingers out, there would be an imprint. Yeah, you can see my little 5-finger imprint, and then it would slowly come back. You know, you've set something on, and so that's what
memory foam.
Memory foam, exactly. So you stick it in and you make the dimples, and then it slowly comes back. So depending on how aggressively you stretch and how fast you reset. Now see these NFL players.
Not everybody's neurologically tuned.
The better shape you're in, the faster you're going to reset from a stretch. Where some people aren't going to recover from it as well. But I guarantee immediately after a stretch, most people will be dimmed throughout the body.
So if you can imagine being an athlete, this is what I want to drive home. I think this is a really important point for injury prevention. If this can save people from tearing their ACL or their labrum or whatever, these injuries that take you out of sport for a while and potentially require orthopedic surgery. That's why this is a big deal. Is if you are passively stretching before you go do your whatever, and you're decreasing your muscles' ability to respond or contract, if you're inhibiting global muscle function, if for some reason you're not a Porsche and you don't just snap back on and you don't have that, you don't know, you are potentially leaving your muscles 10, 25, 50% or more inhibited when you need them on and stabilizing you to prevent you. If you go to cut or do something, you need as much muscular stabilization as possible to prevent tearing ligaments or doing damage to tissue that is going to be stabilizing it in lieu of muscles doing it. Right? So if you don't have the muscles there that are stabilizing the joint, it's your ACL, your PCL, your MCL, and your LCL holding on for dear life in the joint capsule and your meniscus.
Exactly.
And now all of a sudden there's tension on these tissues that there shouldn't be, and you go to do a movement, and that's, now you're potentially likely to tear or do damage. Where if you went into that practice today where the muscles have been activated, which I think it would be a good thing to talk about next, like what actively prepping the body for sport would look like. If you go into it with that, now you have as much stability and help around that joint as possible, and you're going to be far less likely to damage the ligaments that are going to be there to hold on for dear life. Right?
Yes.
Agreed?
Yes.
So what would actively, so telling people what not to do, what would be the smart way? What do you do when you go to the gym and you want to wake up your body and prepare it for new loading and ranges of motion? Like, how do you prep the joints from the knee to hip, shoulder? Like, what are you doing?
Yes, I do zero passive stretching. I do all my stretches.
What does your warm up look like?
I use light weights. So just like, so rather than, like you said, I see people right before they run, they'll put the buttocks to the heel and stretch the quad, do this and start running. I'd rather walk a little faster, and then maybe jog to the tree, walk again. And of course, I'm 56 now.
So you're not showing up to the gym and going full sprint.
No, I go with 1, 2, or 3. I go the lightest settings on the machines or light weights, and the older I get, the longer I'm warming up.
Because the idea is you're trying to get the brain to make sure that it's talking to those muscles, and that area is stable before you start increasing demand, right?
Yes. And some muscles, and I'd say if I got you on the table and started testing your muscles, some muscles don't need a warm up. I tell you, some muscles are just on, and other ones take a little time to get going.
Do you find that there's certain areas that tend to be more inhibited in people, like the muscle surrounding a knee or a hip or a shoulder?
Funny enough, hamstrings have been off a lot on both sides. Where usually I see a lot more unilateral weakness. Not many people come in with bilateral weak, or one side of the body will take 30, 45 minutes, the other side will take 10 or 15 to do.
So you're not going to the gym and doing like a series of isometric contractions. You're just kind of going through whatever you're getting ready to do at a much lighter level to try to wake your body up.
Mm-hmm. And I do some isometrics.
Okay.
Yeah, and I do like the isometrics.
Some of your problem areas that you notice you have decreased range?
And yes. And
give an example of
I don't have really good shoulder flexion. So that's better than it used to be. So yesterday I had the with that hose thing, not a Dynaband. TheraBand. Okay, good enough. Yeah, and I did it one arm at a time. Well, see, and the other thing too is I didn't swing it there and come back, because again, you can get momentum. So if I want to be able to take my arm there, I have to be able to hold it there. So there's a big difference between swinging something there and holding something there. So I did it with this arm, did it with this arm, did it with both arms, did it with the arms this way, did it with the arms this way, and then I turned.
Because you're hitting those different keys on the keyboard. You're going ding, 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 ding. You're trying to...
all these different angles, and...
with super lightweight.
Yeah, so the rubber band was not heavy at all, and then that's what's hard to do anyway with a heavy weight or with the cables. But I think stretching too. Unless you're in Cirque du Soleil or ballet, actually I should defend ballet a little bit too. As my wife pointed this out to me, is the stretching's before class, and then after that everything's active. With the only exception, and they always show it on TV, is, so they're stretching before class, passive stretching before the class, and then they put their leg up on the bar and they bend forward. Other than that's the only thing passive in the class. The rest of the class it's all active. It's all holds.
True.
So
that's how they're getting away with murder.
Yeah. So if you do passively stretch, some people just love it and they don't want to give it up. So if you do it, just take more time to warm up then, and you will bring these muscles back on by but why even do it in the first place unless you
have to have that range of motion? But my thought is, as soon as you start, are you really achieving more range of motion by doing that? Isn't the body going to limit it back to what it can
go under anesthesia? Don't people just go
limp?
So just go limp. And so is it the joints really holding them together, or is it the muscles that are and so the nervous system is going to dictate how much motion it's going to allow you to move, depending on whether you can.
That's a great point.
Yeah.
That's honestly a really good point. When somebody is knocked out.
Yeah.
Or
knocked out too. Yeah.
Knocked out or under anesthesia, and you see people just go limp.
Yes.
As soon as they're awake again and the muscles are bracing, they don't have that motion. But if they have
so much motion when they're unconscious. So
that's how you know it's not.
It's
like,
not a
it's
joint.
not the joint.
Yeah, it's not joint
That's a
capsule
good
or
point.
type. And even the IT bands, everybody want that.
Everybody's got a
Yeah,
tight IT
yeah.
band.
Well, you want a tight IT band.
Right.
It's just like you want a tight tow rope. If you're gonna tow a car, you don't want a first car to go and the rubber band is. You don't want to tow a car with a rubber band.
Yeah.
Because soon as you pull on this, soon as I contract my bicep, I want that tendon to pull the bone. I don't want that tendon to stretch and then pull the bone. So if the IT band is tight, it's because the muscles are tugging on
You're
it.
putting more demand on your body. It's going to tighten up in response.
Yeah, it's not the IT band's fault. It's supposed to be tight. It is a chain. A chain's not supposed to stretch. It's supposed to transfer force. And so let's again go back to the muscular system dictates how much tension, or the nervous system dictates how much tension are on these muscles. And the amazing thing is it can make a muscle loose like a slinky, or it can make it stiff like a garage door spring, depending on what the demand is.
Yep.
But when the body's afraid or it's under guard, that's when you're going to see those garage door springs. And then here in our ego, we're going to override this, and you can override your body's protective mechanism. And that's why I say I stretched my hamstrings, they were loose, the next day they were tight again. And because I never addressed the underlying weakness.
How would you say neurologically M.A.T. is working within all of that's happening with the body, right? The body's always adapting to the stresses and the demands that are being put on it. How is M.A.T. working within that to achieve better performance, a range of motion? Like what are you doing neurologically in maximizing that system? I know that's kind of a weird question, but like.
I don't know, jumping around. It's come to mind. I don't think I'm going to answer your question though, but
Okay.
I started to go to these pillars. Like when
Yeah.
I started talking, I talked about range of motion a long time ago, and
Yeah.
that's the first thing you want to do is check for range of motion. And then once we establish where the tightness is, we're interested in the muscles that take you into the position rather than the muscles that are holding you back there.
Guarding.
So one by one, we'll start putting this, different angles, putting muscle fibers in a.
That's a big point though. It's not the muscles that are guarding that are tight that are necessarily the problem, which
No.
is what everybody always goes after.
Yes.
They want to stretch out and massage the muscles that have guarded the area.
Yes. Yeah, the
It's
guard.
usually not the problem.
Yeah, the
it's
peripheral-
usually weakness
Yeah.
and inhibition in the muscles that are.
That's exactly. Yeah, I should have said that. Yeah, everyone's going. That's what makes M.A.T. unique. Is we are not going after the tight muscles.
I mean, can you think of another modality or even profession that has that same mindset?
I don't
Besides,
know.
like,
Yeah, and that's
maybe
what
training.
And Greg Roscoff, the developer, says. Yeah, there's no one else has this approach.
Yeah.
That's what makes the M.A.T. unique. Is
Yeah.
we're not interested in where the pain is. We're not interested in where the tightness is. We're just checking to see who's functioning and who's not.
Yep.
And every time I take one of these rubber bands off of here, it puts more stress on somebody else.
Exactly.
And so if I
had 5 rubber bands left on here,
yes,
right, and a few of them were on one side, they're going to be under way more demand. What is that muscle going to feel like, behave like on a human body?
yeah. Right. So let's say there's 5 rubber bands on this side. There's only 1 on this side. Well, it's going to be leaning this way. So what I have to do now is I have to tighten this 1 rubber band to match the 5 rubber bands over here. And I'm like, why? But I don't like that tight muscle. Let me stretch it. But then, so I stretch it. It makes it longer again. But unless we address this imbalance, the tightness is going to come back.
And let's say like you had removed this batch, and there was just this band here.
That's
To achieve the range of motion where you've got to go that way, in the absence of that band being there, you're going to have to use the lateral fibers, an edge of that muscle to try to get as much of that range of motion as possible, right? So what is that muscle physiologically going to feel like on a person? I'm trying to get you to like, if I had that going on with me, what's that muscle going to feel like?
Yeah, well this one has to do 2, 3, 4 times the job because the neighbors aren't there. It's going to be probably chronically fatigued or
Spastic,
tight.
trigger points,
Yeah, and it just,
locked up, and you're going to go to the massage therapist and they're going to go, oh, Joe, Joe, this muscle is so tight. Let's work on this for a while.
It is.
And this is the only muscle that is stabilizing your body because the rest of them are on vacation.
Right.
This is the only one that's even keeping you there.
Yes.
Right? So you start stretching out and massaging and weakening the only muscle that's holding that.
Yes.
What is that going to do for somebody beyond that, day?
Yeah. So it does give relief, but it doesn't fix the problem.
Because that muscle's going to have a lot of pain.
Yeah, so that tightness is a problem, but it's not the root of the problem.
So just going after that, you're weakening somebody. They may have, and I think this is a phenomenon a lot of people experience. They go to the massage therapist, and it's like the next day, they're like, oh my God, that's twice as, it locks up even more because the body goes into even more guarding because the only stability, the only help that we had is gone.
Yes.
It was shut down, and you had that temporary, you walk out of there and it feels a little bit better, but now it's the next day and it's locked up more.
Mm-hmm.
Same thing I'll hear with people who go to traditional chiropractic versus upper cervical. You get the crunch, right, and it just inhibits everything.
Yes.
It's like hitting the reset button, and a bunch of muscles shut down that were guarding and locked up for protection, and it's a couple of days later and it almost aches and it hurts worse because the body snapped back on with all of that guarding once the dimples started to come back up.
Yeah.
And you end up in worse shape almost.
Mm-hmm.
To really correct and fix and restore function to a body, instead of just going after these areas that hurt and even weakening the body, the philosophy, the approach should be recruiting more help, improving overall structure to alleviate this asymmetry, to try to get a body more functional, stable, integrated, strong for long-term decreased pain and increased range of motion.
Yes.
Right? That's where I find what you do is such a perfect match for what I'm trying to do.
Yes.
Versus having a massage therapist in here just stretching it out. And people would be happy and give you a high five that day, but long term, for wellness, it's not ideal for people to have injury, for injury prevention and long-term chronic pain and these kind of things.
Mm-hmm.
It's not therapeutic, it's corrective.
Yeah.
Is how I think about it.
I like massage. I think they're great. I think it's great for flow, movement through the body. And,
but once you've addressed the problem,
you
have the option for massage as almost a pleasure, a therapy, because you like to go get a massage.
Yeah.
You're not using it to address the underlying issues that are causing your symptomatology of pain or decreased range of motion. That's a mechanical problem that needs to be addressed.
Most likely, yeah.
Most likely, short of like a permanent joint problem or something that is an orthopedic issue purely. For the most part, going for massage should be almost like a pleasurable thing, lymphatic drainage, moving, especially in somebody who's less active. If you have somebody who's not exercising regularly, it can be nice as like almost artificial exercise, moving the body and getting tissue and blood flowing, but it's not corrective.
Mm-hmm.
I think a lot of people don't understand that, and so they have to go for these. They have to get an adjustment, weekly or 3 times a week, or they have to go get a massage for some people every week, just to feel like they're keeping the demons at bay.
Yes.
Because they're not addressing mechanical problems, and there is a way to fix that.
Yes.
A lot of people don't realize that, and M.A.T can do that.
Mm-hmm.
Yeah. That's my thought on it.
Yeah. I had one guy he was a financial planner or whatever, and at a time when the market wasn't doing well, and he gave me, I worked on him 3 or 4 times. He did not have good body awareness, but I know he was getting better, but he wasn't feeling better. But of course, some people are just going to measure, did M.A.T or did anything work by, do I feel better? Well, you don't know what's causing the pain, but I know his muscular system was functioning much better.
Exactly.
And even though his symptom, whatever his symptom was, wasn't going away. And then I told him, go get a massage. Because I think he was so uptight, and so I think the massage, and I didn't realize that because I always thought that you had to have
stress relief.
Yeah, you had to have. I always thought a mechanical problem was caused by a mechanical situation that caused it, but food.
I'll say it too. Stress.
Yeah, chemical.
It'll cause the atlas.
You can have you can have a chemical stress, physical stress, or emotional, which is kind of chemical also. So any one of those, you're not eating right or something you're allergic to. And I just think he was so uptight and wound up that the massage may have just done him relieve some mechanical problems.
Sure.
Yeah, so I mean, I think there is that case. But most of the time, if I have a mechanical problem and want M.A.T, if I want to feel like a king, I go get a massage.
Sure.
So,